really intrigued by this topic of conversation because it is certainly true that women and men have been leading through this time of crisis. What we see with COVID-19 is that this crisis has come about because of this pandemic, and this crisis has also shown us that there were things all along that we need to pay attention to. And I'm so glad to have three panelists with me to talk about the crises in their own lives and leadership communities. And I'm just ready for them to appear on the screen. So without further ado, our first person that you'll see is Alex Wallace Creed. Graduated just the year before me from Columbia College, 1988, head of media and content at Verizon. So welcome to Alex Wallace Creed. Our second panelist is Dr. Aletha Maybank, who is from the class of 2006 from the Mailman Center, and she's the Chief Health Equity Officer and the Vice President of the American Medical Association. So welcome to Dr. Maybank. And last but not least, we have Sheena Wright, who is a 1990 graduate. I remember Sheena from our days on campus. Sheena is a class of the 1990, as I said, from Columbia College, as well as a 1994 graduate of the Columbia Law School. She is the president and the CEO of the United Way of New York. And as these three wonderful leaders are all in their respective boats, so to speak, we're all in the same storm, even if we're in different boats. And I'm so excited to be with them and to ask questions of them. And I will say to all of you that as you are listening, if there is a question that you have for them, please use the chat. We'll be looking at questions and use the Q&A because we'll have a time for questions toward the end of this hour. I also want to say, as the daughter of a preacher, if you just want to say amen and you just want to raise your hands, you can do that too, because sometimes you just want to affirm what's being said and you don't have a question. So don't leave us out here in Zoom land by ourselves. Let us know you're there. Let us feel that Columbia spirit, even as we sit today in our respective spaces. So with that, we're just going to launch right in, and I'm going to ask a question that we often ask, and then people usually walk right by. Someone says, "How are you?" and they keep walking. But tonight we're going to pause and really ask these incredible leaders, how are you? How are you doing? How have you been managing your lives and your leadership during these crises? And again, when I say crises, we're talking about climate, we're talking about racial equity, we're talking about poverty and economics, we're talking about Corona, we're talking about so many things. And you get to launch into any and all of them as I ask that question. So how are you? How are you? Alex, why don't we start with you? How are you?
Well, first of all, your energy is infectious, so I feel a lot better than I did 10 minutes ago.
Good.
I love that you just said that, because I do think we go through our lives saying, how are you? And I usually say fine or great. And I never actually think about what the answer to that question is. And I've been thinking a lot about that. And then when I've been asking people to think and respond. And so it's really interesting. Every single minute of the day, I'm different. Right now, I would say I'm a combination of very high and very low at some point during the day. And I try and find the middle as much as possible. And I think that's how probably a lot of us are, which is the kind of, as we're balancing so many different things and struggles and also silver linings, how do you kind of try and come back to the middle? And so that actually fine may just be a simple word, but it's got 7,000 things behind it.
I love that. Thank you, Alex. Aletha, how are you?
Hi, everyone. Hi, Wanda. Yes, great question. The way that I typically answer this at this moment, to be honest, I'm exhausted. You know, I'm in a healthcare space per se. I'm not on the front line, but definitely working to support health workers all across the country in many different ways. And starting a new Center for Health Equity at the same time. So, you know, the word's not quite rewarding. I think this is the work that we should be doing, or that I should be doing, as it relates to justice and social justice and at the institutional level. So it's meaningful. However, just really working to constantly find those ways to value my work, but also myself. And I guess my time, my relationships with people that we know are very important to us. And I think, as everyone just working, I think, to find that balance always. And I don't know if balance is the right word, but just to find those moments and opportunities to make sure that I'm connecting in ways that help energize and rejuvenate me. And then also finding those opportunities too that also just bring joy. I think oftentimes in the justice space, we feel that there has to be a trade-off. I mean, that's kind of maybe a scarcity mentality in a way, that we can't experience joy and we shouldn't experience joy, and joy has been stripped from us. But I think finding moments and opportunities for that have been really crucial during this time.
Thank you. Sheena, how are you?
I have to say I second all of those emotions. Absolutely.
Yeah.
So the seesaw, the exhaustion, from where I sit, at the United Way, we have been kind of on day one trying to really make sure that low-income New Yorkers, community-based organizations, emergency food providers, education partners, health partners have what they need, in addition to the continued fight for racial equity and social justice. In addition to being the mother of 4, and these people need to eat every day, all day, it seems. In addition to, being a daughter and a partner and it is exhausting. And at the same time, as you said, that meaningfulness and fulfillment in the work, but also really try to be very intentional and just every morning wake up and just say, thank you, God. Because we are blessed and highly favored if you are here, if you are breathing, if you have what you need. And so really trying to be in that space of gratitude and appreciation for what I have is really an important grounding for me.
That's so important, Sheena. It's so interesting to hear you all, talk about the exhaustion and the teetering and the meaningfulness in the same breath. It reminds me of studying poetry at Columbia, where we would deconstruct Robert Frost poetry. And one of my favorite Robert Frost poems is, after apple picking, and he says, I am tired of the great harvest that I desire. Right? So you can be tired of the work that you choose and still need to create boundaries so that everything doesn't permeate your consciousness. As I try to manage over 100 teachers, all of whom believe that they're truly at greater risk being at work, and also knowing that the way we should deliver education is in person. They too exude all these emotions, and then we have to find a way not to hold everything. And I'm just a quick follow-up. I wonder if you feel like, are you holding everybody else's emotion, not just your children? I have 2 boys. Do you feel like you're holding the kind of the emotional center of your organization in addition to your own?
Just listening to what you just said, first of all, I think it's really interesting that all of us are in some ways on the front line, maybe not as much as Aletha, who really is in healthcare, but I'm a journalist. I run journalists who've been arrested and pepper sprayed over the last few months. And so in some ways, and we all also have purpose-driven careers. And so in some ways, I think that does make it also particularly exhausting, because when I go to sleep, I'm worrying about racial equity and COVID. And when I wake up, I'm worrying about the same things, and that's my life and my work. And so I think it is interesting that we are, that probably it's hard for any of us to separate life and work right now, particularly in the areas which we all work.
Indeed.
And I see your question about kind of holding that emotional center for, the places where we work and the people we're engaged with. Yeah, definitely as a leader, everyone is looking at you. And they're taking their signal. Are we okay? Are we not okay? How they should react. And they're trying to cue off of your behavior. So appreciating that is also extra heavy and important. So that is definitely, I think, part of the role.
Yeah, and I would add to that, I and to both of what was already expressed and shared. When you're in an institution or an organization that is working on embedding equity trying to understand their own mental models of how they come to this work and how they have to work to dismantle racism. That's the extra kind of burden, you know, and that is, to me, honestly, the more exhausting part of this work. It's one thing to be in solidarity with folks and in partnership and collaboration and coming together with your whether it's your friends or your colleagues or your allies, and you're on the same page, you know. But when you realize like you're not on the same page with folks and you have to do a lot of education up, across, around, down, about what racism even means, that race is a social and political construct, like you're at that very fundamental part, that is what feels like the real heaviness from my perspective at this time in this work. And the demand is tremendously high. I'm sure Sheena feels it as well as Alex, you know, to have more information and conversation around justice and equity. And it can be inside of our organization and outside of our organization that demand is coming from, and figuring out how to be responsive to it in a way that, again, is meaningful, helpful, but also acknowledging like our boundaries that we have to set has been kind of first and foremost for me right now.
I love that. Sometimes I say just being a woman in this world, being a Black woman, being a gay woman, you know, in and of itself can be an act of revolution. Just to exist, right? So, you know, I love this. Let's keep building and talk about leadership and talk about what it truly feels like to be effective in this work. And, you know, sometimes you have the same issues and you need different tools to manage, you know, leadership forward. You know, and I'm just curious, as you think about how you are now versus even a year ago or 6 months ago, how have you had to pivot as a leader? You know, are there skills, as there are many people listening across the world on this call, maybe they're looking to you because they're aspiring leaders, or maybe they are in similar situations as we are. What might you share with them about the skills, the lessons you're learning in this new reality? Anyone want to start there? How are you pivoting, and what lessons and skills are you amplifying perhaps, or gaining for the first time?
I would just say, in a time of great chaos, the need for focus and steadiness has never been so clear to me. And so the louder things become, the more I really try and think, what do I need to do today? What do I want to do today? How am I going to improve the world? When I go to sleep, how will I have done something that helps improve the world? And in some ways, it's been easier because there's so much noise. You actually have to do that. I'm thinking about that with my kids. I think about that in my marriage. I think about that with my friends and work. Like, am I spending my time really valuably? It matters what I do. And I can do nothing today, or I could spend the day really well.
Yeah, and I would build on that, just like in the noise, the need to communicate. I mean, I find myself really having to, you know, we have much more frequent all staff meetings, kind of the one-on-ones, the team, because we are not physically together, and there is so much going on where you can just be paralyzed. Like, what am I supposed to do? Like, there's too much. So that the need to really, really communicate regularly, transparently, and as clearly as possible. And I would say the other thing is agility. It change every 3 days. So as much as we might have loved it, we have a beautiful strategic plan, and over the next 3 years,
right.
Window, and the skills that you need to be agile and responsive as you are trying to really focus on, like, as you said, Alex, kind of delivering every day what you know you need to deliver, but how you're going to do that today versus 3 days from now when the world has changed, right? It's huge. Like, we had a big census effort where we were really trying to make sure we have a fair and accurate count, and guess what? Supreme Court said that's over. And so it's like, okay, so it's you have to be agile in this environment.
Absolutely. Sheena, when you're talking about, you have to have greater communication, more meaning, all of that, that also creates more meetings, like literally, right? And so like, it's just the back to back. So I counted today, I had 12 meetings today, 12. And it's just like, okay, how sustainable really is this? And I think that's the question that we're asking. And so the pivot for me, I think in this very short period of time, is to say no. So I'm sure we all get requests to speak everywhere. I took Columbia on because I feel, you owe it to those who give you degrees, and you're able to kind of leverage and capitalize on it. So, but for the most part, oftentimes now I'm saying no. And I think that is a pivot from my leadership style. Oftentimes, I've been I try to be very accessible as a leader in equity, whether it's to, the organization itself or other folks, but I have to pivot at this time. But also I think, because I feel a lot of folks and other leaders are more accessible in this virtual setting, that's another pivot to like just really capitalize on that opportunity. There are people that I could connect with now that I probably wouldn't even have the opportunity to connect with before. So I think it's a time to leverage that, and to use that to our advantage.
I love that. I love that. Just because I'm a teacher by training, just in case people, you maybe, got to get something to eat for a minute, just really listen to what these amazing women just said. Ruthless prioritization, right? Communicate, be agile, know how to, be nimble and flexible, focus, find value and meaning, say no, only do the things that bring you value and meaning, leverage your networks. And I might add, be creative and innovate. I have done some things that I was like, oh, you put some of that over that. It reminds me growing up working class in Brooklyn. My mother could make a stew out of things that you might not have thought the ingredients should make a dish. But somehow out of incredible stress also comes creativity and innovation. And I have found that to be something to harness, particularly when you need to deliver educational excellence every day to children. How do you get that done when you don't have any of your tools and usual ingredients? Very humbling, to say the least. Thank you for those lessons, and we should put them in a book and a pamphlet. We've talked a lot about equity already, even as you talk about the risks for journalists or healthcare, or the people who some might call the least of these in the world, who are on the margins and need the support that the United Way and other places provide. And I am curious about the ways in which you, as this gathering is called, you open the door for others, that there are people who need you and people to whom you feel indebted or responsible. And I just would love for you to talk a little bit about, how do you see this time as a time to open the door for other people in your respective professions? How are you working? How do you become equity workers? Alethea, you are an equity worker, an equity officer. But maybe put some more color on that. Like, how do you think about equity in your day-to-day work?
Wow, it comes out in so many ways, because equity it's a process and an outcome, right? And the how we do the work is very critical. So I'm trying to think of even just concrete examples in terms of, engaging with staff about, we're going through an internal part of the work. So I am a believer that we cannot do equity on an outside of an organization in partnership with people unless we take care of our own house. We look internally, we do our own kind of normalizing around conversations as it relates to race, power, and privilege. We organize internally, and then we have tools for staff. We're going through this whole internal process, doing an assessment. And part of that and going through it and what we're working on now, we just finished our survey of all staff, and we're getting ready to share that with staff, and get ready to engage staff in the process of planning around what should we do now that we have these results. And so it's a constant kind of, equity shows up for me in like constantly advocating on the part for staff oftentimes. I'm just talking internally, that we need to have inclusive processes. So we need to offer an opportunity where staff can be a part of these processes, and not from a top-down typical way of being white dominant culture, to say, no, this is how it should be, this is the structure, this is what I'm comfortable with. I hear that all the time. I'm not comfortable with this, I'm not comfortable with this. So, part of how that shows up on a day-to-day basis is a constant advocacy for funding, advocacy for resources, for my teams. You know, that's one way that it shows up. I think in the larger context, in terms of just how I interact and recognize where my position is in this in our history of equity in this country, is that personally I'm standing on the shoulders of every single person that has come before me and opened those doors, and my responsibility is to make sure that I'm doing that with those that are coming, I don't know if it's after me, beside me, whatever it is. And so I've set up monthly calls for the young folks who reach out, who want to have a conversation with me. I can't do that, you know, for every single person. So I've created space so that we can talk and they can learn how to network, you know, and what it means. And if they have questions about, and it's from like undergrads to residents in the medical profession to actual physicians. So it's been a really beautiful and kind of budding process, but that's one way of which I'm trying to figure out how to show up for those that are coming after us as well.
I love that. And we're trying not to feel old in the process right now.
Yeah, I'm sure. Yeah, look at me.
Experience.
Exactly.
Alex, how's equity showing up in your work?
So first of all, I always think about who opened the door for us. And so Ruth Bader Ginsburg, sits on my desk.
There you go.
That's true.
We cannot have
planned that. Have it.
Let's high five.
High five.
That is awesome.
So I literally look at her all day, and I think if she could do it, you know what? She did it for me, and I'm going to pay it forward. I'll just talk about the equity work, which I think is really important. One is, you know, I've been involved in diversity for 20 years or even longer, and people say, is this time to be different? And I'm an optimist at heart, but I actually do think this time is going to be different. And I'll tell you why. It's because the conversations that are having in the work that I'm having in the workplace. Always had these conversations in my personal life and in work places outside of work. But to what Aletha said, one, a lot of people are very uncomfortable. And I think leaning into this, the discomfort is really important. It's going to be uncomfortable. People don't like talking about race in the office. It does not make them happy. They don't know a lot of them don't know how to do it. And guess what? That's what we all have to get comfortable with, is discomfort. So that's one thing. And I think also to Aletha's point, really listening. There is a lot, if you listen, about kind of like, she's not ready. You know, when you go into these kind of hiring things, she's not ready. I'm not sure his qualifications are exactly what we're looking for. And you know what? Now I find myself all the time saying, like, no one's ready. I mean, I'm not ready to get up in the morning. So we're never ready for anything. So we have to be much more intentional and thoughtful about who we give chances to. And like, I'm actually just calling it out a lot more than I ever did. And I think also accepting you don't know, there's so much I'm learning, and we don't, you know, listening and then committing to helping to try and improve and fix where we are.
I love that, Alex, because you know that they're not a right fit. They're not like us. It's just coded language for unexplored and uninterrupted biases, right? And we got to get out of our own way. They're not like us. So what do you mean? Who are we? How do we interrogate? I think as Aletha said, that white dominant culture sometimes, or maybe it's a different way. Maybe it's regional, you know, who knows? But there are so many ways in which we perpetuate inequity, and we've got to stand up and interrupt. I love that. Call it out. Sheena, I feel like your whole life at the United Way is about standing in the gap and making sure the marginalized find their way to the center. So you live, breathe, sleep, eat equity all the time. Can you say more about that?
Absolutely. And, you know, it's so I think what's happening now is that we can all be just much more explicit about racial inequities and social justice. And as you said, we are working with low-income people of color in the city of New York. So when we talk about, you know, some of the gaps, for instance, in educational opportunities, and try to understand, you know, why do Black and brown children not actually have the resources that they're supposed to have by mandate, by formula, you know, by legislation for their schools? Why is that? You know, it's not by accident. Like, the system is designed to disenfranchise, and really cripple Black and brown people in this country. So I think what's interesting about this moment is that people want to learn So there's a whole educational process. We didn't get here in 2020 in the United States of America with the kind of disparities that we see in opportunity and outcomes by accident. And so people, it's particularly a lot of our corporate partners, we work with 103 corporate partners, while we have a very diverse staff, our board is a little bit less diverse. And so people understanding how we got here in terms of the education and then trying to organize them to do something about it. Like, what can you do? What do you need to do specifically? What can I do from where I sit? And that's what's exciting, I think, about this moment. We have more actors and investors and champions who want to actually move the needle and change opportunities and outcomes for people of color.
I love that. And I love the way that, Alex, from the individual, and making people uncomfortable, and Sheena also talking about systems, and Aletha as well, people and systems. I think so many times when we talk about equity, people think about individual acts of kindness and courtesy. And yes, there are individual skills and competencies we need to build. And we need to interrupt systems of oppression, which perpetuate individual biases. And I really, I'm just so inspired by the work that you three are doing every day. I feel the same way in my own world. I think I call myself an edu activist. I think education is one of the most powerful forms of activism. I put myself through Columbia, paid for every dollar of my education, first generation kid going to college. And I know the power of education to change one's trajectory, which is why I'm so glad to hear, Sheena, and all of you who are working on outcomes for kids, so they can grow up and thrive and be the people we want them to be. So thank you for your work. It's incredible. We began by saying, how are you? And I asked you about your individual self-care. Reminds me of Audre Lorde, who says that, kind of self-preservation and self-care is kind of an act of revolution as well. But let's go back there. And Aletha, maybe we'll start with you as a person who kind of lives in this health space. When chronic stress has become the norm. I mean, we wake up with it, we put it on like a cloak. We just kind of live with it. And in some ways, I think that's harder than the punch in the nose. It's like someone's tapping you constantly, feels more stressful and annoying than one big punch, perhaps. So how are you and your organization focusing on self-care and health as you try to take care of other people's health and healthcare? How are you managing all that now that, this is how we're living, at least for the foreseeable future?
Sure. So I think one way, definitely, so we're AMA, just for those who don't know, American Medical Association is a physician organization. It's an organizing body. We represent about a fifth of the physician community directly through membership, but also work more broadly in the advocacy and lobbying space. And so a lot of our work over the last couple of months has been understanding better what is happening with the physician in the context of the system as well, right? What the physician is very impacted by whether the system is working well for it or not. So both of those are absolutely critically important for us. And in kind of listening to physicians, doing different surveys, we've learned a lot about their experience and learned a lot about the ways in which they need to be supported. And so we have set up lots of resources as it relates to mental health, support for that on our websites, but also in conversation and communication. But at the same time, also advocating and using our power arm in that sense at the federal levels to constantly advocate for those changes that need to be made at this time in order to support the physician and healthcare community overall. As an example, so today, a letter was sent out, so folks may remember the executive order that was sent by the current administration last week, 2 weeks ago, about race and sex, that basically said that folks should not do diversity trainings and had a lot of criticism about critical race theory, kind of the root of my work and many of our work. So today, we sent a letter along with the American Hospital Association, American Nurses Association, to the Trump administration saying that we are asking you to rescind that executive order. So those are the things that we do in order to be supportive at the system and structural level. And then at the more kind of community level for physicians, it's providing those resources and creating space. Launched a series called Prioritizing Equity to hear from marginalized physicians. So for those who don't know, the lack of diversity in the physician community is tremendous. Blacks and Latinos only make up about maybe 6 to 8% of the physician workforce. Yes, it's really exactly. And so oftentimes their perspective and their experience doesn't get heard. And they're more likely to see patients of color who are more likely to have COVID, who are more likely to experience all the social inequities that Sheena deals with on a day-to-day basis and handles on a day-to-day basis. So we have done our best to create more space so that we could hear what is happening and interact directly with those particular groups and communities to be responsive. So those are some of the ways I think in the work itself that we were trying to help support people during this time. It's almost like Melissa Harris Perry, sorry. She talks about the importance of not just self-care, but squad care. And so I think, I think of our work as being that. And we actually launched a partnership with Essence to help support women during this time of COVID, because we knew that Black women and women of color in general were not seeking care because of fear of going to the healthcare institutions and to their doctors in the hospitals. So what was a vehicle to provide information, still encourage folks that they still need to take care of their other health needs that have been causing chronic stress for a very long time, but also encourage them to work and with their squads, and creating a wellness plan even during this time. So just, you have to, as you said, be creative, be willing to have partnerships in ways that you may not have had before as well.
Love that, squad care. Like, remember the show Mod Squad? Well, anyway, I'm dating myself. But anyway, that's what I immediately, that group of people that connect around a certain purpose. I love that. Yeah. Alex or Sheena, do you want to comment on this idea of, self-care, morale, mental health, now that it's become the norm? How are you enlisting your folks and supporting them as we respond to these crises?
I mean, we talk about mental health all the time in the office, which is another thing. If a year ago you had told me we were talking about race and mental health every day in the office, I would have said, I'm not sure who you're talking to. So mental health, destigmatizing it, people talking about anxiety, stress, what is depression? I mean, we really, in meetings all the time, we've brought in mental health people to come do full company workshops. I think the ability to, when you say, how are you? The other day, someone said to me, I'm depressed in the office. And I was like, good for you. I mean, thank you for telling me. And I think we have to get to that as a baseline. And then just personally, I've done two things I've never done before. One, I've become obsessed with sleep, which, we all sleep, but I never really thought about it. And so I got this sleep ring. That's what this is. It tracks my sleep. And every morning, of course, it's another thing you can track. So it's a little unfortunate because I wake up in the morning, I'm like, how'd I do? And then, you find out that you didn't sleep. I know it's bad. I'm a competitive sleeper now, but kind of really intentional about my sleep, and then the other thing is I put exercise in my schedule. I am kind of a naturally sedentary person, but it is the best mental health buster for me. And so I block it out and it's my calendar, like yoga, which normally, a year ago I would have hidden that and I would have said important dental work appointment. So that even my EA didn't know what it was, but now I write yoga, going for a walk, and then forcing myself, I still don't want to do it. I still would rather answer the emails, but really, really forcing, again, walk, yoga. I am not running any marathons.
Love that.
No, and just I actually ran at Columbia track and cross country. So go Cougars. So you're absolutely, you're so right just about exercise and diet being so directly tied to your mental health. And I know kind of obviously that can, spout off all data on that, but it's true. And so trying to, like you said, force yourself to do that, and definitely those kinds of conversations that we do have in the office and community, and people are sharing. So I was just on a meeting today with some external people, and, one of the things we always do is a check-in. Before we get to any business, how are you? Like this question that you started us with, Wanda, how are you? And people will say, I'm tired today, or, or, and then on the call today, this one woman talked about how she teaches a yoga class. So we're like, oh, we're all going to sign up for it. So there are all of these, kind of ways, to solicit. We have nutritionists on our staff. We do a lot of work with emergency food, and we want to make sure that low-income people are getting really healthy food at the end of the day. So our nutritionists kind of got together and did a Zoom on like how to do great things with things that are in season, and we all had practiced and everything. So there are ways to do it, in a fun way as well. And just in terms of the mental health piece, I think one of the things I know that we've all been experiencing, certainly in the wake of the consistent murders of Black people, and for me and certainly my team and other people that we're engaged with, appreciating that every new story account is like a physical mental blow. And we have to create space to allow people to experience kind of, I don't even know what the word is, but to just say like, this is painful, it's hurting, it's constant, it's consistent. So that, then there's so many of those things that are happening for all kinds of people, but to kind of make sure that you create space for people to really articulate how that makes them feel and what they can, I don't want to say what they can do with it, but just to be able to express it is really important. And so that people are not walking around just like trying to hold it all together.
And I think, I'm sorry. And the important part of that too is like, so you feel validated. I think as an employee by your leader, for all those who are listening, who have the opportunity to lead an organization and have no idea how to do that. Our CEO, when the public murder of George Floyd happened, several folks brought to his attention, especially the Black workforce. However, very clear that it didn't just affect the Black workforce, but there was something very particular. And we had just started for the very first time Black employee resource groups across AMA. And so he actually sat for 2.5 to 3 hours to listen to every single person to hear how they were doing. And it's not that he had, great context to what all of this is about, but he is a compassionate human being. And to Sheena's point, created that space. And that's what's meant by it. You don't have to have all the answers. That's not what people are looking for. They're looking for validation and acknowledgement of their experience that they're going through that impacts them potentially in how they do their work on a day-to-day basis. And I think as leaders, we owe that to the teams that we're leading and that are supporting us so that we can do our work well as too.
I love that. And what we're really naming here is the pastoral care, the part of our jobs. It's about taking care of people, taking care of ourselves, and truly capitalizing on our EQ. A lot of times people think that a leader is made or broken on the altar of a decision you made that was highly intellectual and cognitive. And often leaders are broken on the basis of a lack of EQ, a lack of listening, a lack of empathy, a lack of being present and holding space for people. So I think it's very powerful, the people who are listening understand that this is not the soft part of our jobs. It's not a female kind of leadership. It is effective leadership that happens to be in the packages within which we exist, but it's a true part of our work. Gosh, we could go on and on about that piece, but I want to address one of the questions that has come up for all of you. Some of you have hinted at family and the quote unquote balance that we might strike in our lives. And what I want to just ask you, how do you make time for family? Alex, is that in your calendar too? Yoga, dinner, that's how I have mine, family dinner, indoor date night with Robert. How do all of you make time for your family, however you define family? If you have children, how do you spend time with them or help them understand what's happening in the world? Anyone want to jump in there?
And I think the blessing for me has been that for the first 5 months, we had both my kids home. My son is 16, my daughter's 18, and they were both boarding school, and then they both came home, and my daughter hasn't left. So that was really a blessing. Like, and we had family dinner almost every night, and it was in my calendar. Every night I put in family dinner, 7:30 to 8:30. I don't care if I have meetings from 8:30 till midnight, 7:30 to 8:30 is family dinner. And, you know, sometimes family dinner was like, who's got the cheese? Where's the, you know, Wonder Bread? I mean, it was nothing fancy. It just was food. I feel, you know, it's funny that someone was saying the other day about like the work-life blend. I've never felt my life is so integrated actually as it is right now, because I'm working at my home and my kids are at my home and my husband's at my home. And so I, in some ways, feel a more complete person. It's not easy, you know, because, for example, my daughter got a shelter dog, and the dog likes to like go to the bathroom a lot in the floor in our house. And I'm always like, I'll be on a meeting and like, oh, I wonder what just happened. It's not that relaxing, but integrating the parts of my life right for the first time, really.
And not traveling must be cool.
Yeah.
I don't miss that. I'm telling you, I do not miss the airport.
No, I mean, I think all of those things, absolutely, but also acknowledging like all of the extra work. Like I have a 13-year-old who's doing remote learning, and I'm the lunch lady. Like, he comes in the middle of a meeting. I'm like on this important call with a funder, and I'm like making my case, and he's banging on the door. And then he starts slipping pieces of paper under the door. I need food. And I'm thinking, okay, first of all, it's time for this brother to learn how to cook and feed himself, because clearly. But it's like, you know, you have like 25 different additional jobs. And that's real. I mean, as much as I appreciate, I got a house full and we're, you know, appreciating the time, there's a whole lot more to do, to be sure.
And then, so then there's the, I guess, well, for me, the parent aspect, my parent aspect. So my mom's 84 and she lives about an hour away in Somerset, New Jersey. And so considering she's not going out, she wasn't going out, or let's put it this way. Initially she was going out and I had to tell her she couldn't go out because she's just that kind of person, because she wants to be out and about. So she's been, you know, good at staying inside the last couple of months. So I've had to go over, you know, pretty often and visit and, you know, and cook food and all that. And not that she can't, but, you know, you just realize I am her sole source of kind of contact. You know, I think being younger, in quotes, you know, all of us, we're okay with being in contact with people and they're more around people, but she's not. And so, that's caused me to reflect a lot, though, as well, on kind of what does this mean as she ages, and me really sitting in that role and responsibility of being a child and being an only child, and taking care of a parent. You know, the good thing, so today she called me during a meeting. If she calls twice, that concerns me, you know, in a row, and I'm like, what's going on? I pick up the phone. She said, well, I called the Volkswagen place and my lease is up and I'm leasing a new car. She's 84 years old. And I'm like, these people are probably really scared and afraid for her to test this car. But I was like, it's great. Can I hang up the phone now so that I can go back to my meeting? But like, those are the good, like that feels good. I'm blessed. I feel, you know, it's not, you know, she's in good shape. But it does take, as Sheena said, it takes energy, it takes time, it just takes something, you know, that you didn't necessarily have to do as much before.
Oh, I love that. Oh, family anchors us, frustrates us, but ultimately gives us a place to belong, right? Mm-hmm. There are some questions in the chat from people who are, you know, we talked about opening the door, and this is a question that is about giving advice to the generation coming alongside and perhaps behind us. And there's a particular question for Alex, for Olitha, and I'll summarize it by saying, you know, Alex, you talked about value and meaning, you know, early, and looking for a way to create value and meaning. And a recent graduate is asking, well, how do you recommend that a recent graduate who's still navigating a career, you know, do something meaningful each day? And a corollary question is, Olitha, there's someone who is interested in a public health path, yay, Mailman Center, that they want to know, well, what can I do in the early steps of my career to start making a difference. So this is a value question. How do we make a life of meaning and value, even as a young graduate of a Columbia undergraduate or graduate school? And any or all of you can answer.
And I think what's interesting is we can all have meaning throughout our lives. And, you know, I grew up in DC, which is like, it's got a lot of downsides involving politicians, but a lot of people there really are about changing the world. And my father worked for AID, and then he ran an international institute. And it was very much like, how can I help change the world? And so I have always felt an obligation. That's what I feel like in some, even if it's in the littlest way, even if I'm like out walking people across the street or helping feed people who don't have enough food. And so I think kind of looking in your own life about what gives you a sense of meaning and then doing it. And we can do that. You can do that without a job. You can volunteer. Yeah. You can do that with your family members. And that is like meaningful. What you just talked about your mother, like that is really meaningful and powerful and has purpose in it. And so I think it doesn't have to be this high and mighty job. It can actually be just how you choose to spend your time and show up for other people.
Yeah, amen to that. I think that's right, how you show up for other people. I would, just add specific to public health. I think we're in there's almost an easy time in a sense in figuring out what to do as it relates to public health, or that's connected to, because all of social injustice from my perspective and the pursuit of social justice and racial justice is all about the public's health. And so, there are many ways to being engaged. So voting, like if we participate somehow in voting and getting people to, well, we're almost past time for registration, but at least getting them out to vote, seeing what you can contribute to that. There are lots of organizations. As a public health person, there's American Public Health Association, and join that. They're doing lots of advocacy and organizing, and especially in the area local to New York as well. So I encourage one to get engaged with advocacy efforts, and advocacy efforts that are of your interest, and areas that you can volunteer in, because all of those are going to be applicable to starting your public health career. Public health, I feel, of real value. And Columbia actually held strict criteria to this at my time, was that you had to have work experience or real life lived experience before even getting accepted into a school like Columbia. And so, I just say there's a lot out there to do right now, and a lot of need and opportunity for public health.
Now there's something here that and you can tell that the light is changing in California, right? I'm like looking very supersonic here. This is just a quick follow-up from for you, Aletha, that basically says the Pediatricians Association last year issued a very comprehensive policy document about racial equity and its impact on children, and it issued a detailed plan on how all sectors of healthcare, of the healthcare field that deals with children, must be trained and operate in order to eliminate disparities. And she wanted to know, is the AMA doing anything similar?
Yeah. So just so I can provide some context a little bit, because I think it's important. I'm looking at the question as well. AMA has the history, I say lightly, the AMA kind of is the history of racial injustice, the poster child of it. We excluded Black physicians from the AMA up until the 1960s. And that has had a tremendous impact, I think, on the diversity of our physician workforce. And we also had, there were several things that happened in our history, let's just put it that way. And I think for the medical profession, especially, it is really important for us to have a reckoning of the history that not just only the AMA has, but science overall in medicine, towards the advancement of really racial injustice. And so the AAP, the Pediatric Association, issuing an explicit statement actually as it related to racism was really leading a few years back. Most medical organizations were not at the point of talking about or naming racism. Public health was there more so, but not medicine. So AMA was definitely leading the pack. This past summer, with again, the public murder of George Floyd, the AMA Board of Trustees for the very first time put out a statement and a pledge against racism, and explicitly stating that racism is a public health threat, and that the AMA was going to do all of its power and work towards dismantling racist policy and practices throughout healthcare. This was an explicit statement. And for somebody who's leading this work, you know, I'll use rewarding at this moment, you know, to kind of see that happening and to see that movement. I don't think many of us thought it was going to happen, and especially really from the AMA. So we did do that pledge. We are now working on our strategic plan of what that will mean in terms of action. And hopefully that will be released. Well, it has to be released at some point at the later part of this year of 2020. So, and the hope of us doing it as the AMA, because we have relationships with all of the physician associations, whether it's the radiologists or the surgeons, is that they will also take that on as well.
Love it. Sheena, did you want to give anyone if they want to be a public servant, if they want to stand in the gap? Is there, I always thought you should be the mayor, I'm just going to tell you, of New York, but I'm like, come on, Sheena.
Oh, baby. Oh, baby. Uh-oh. You know, it's not
Just put it out there.
I think, you know, what Alex suggested, like, lead where you stand. There are so many things that you can do. And I think one of the great things about what we're able to do, what I'm able to do at United Way, is really connect people to their passion and interest and really put them to work in really meaningful ways. So whether it's you're going to spend an afternoon at a food pantry or soup kitchen where, like, you know, hunger and food insecurity is at an all-time high, whether you're going to be on a board of a nonprofit and lend your expertise, if you're in marketing and communications, if you're going to help a nonprofit figure out, well, how do I pivot to an online world and connect to my clients? I mean, in order to do what needs doing, certainly for people most in need, we need everybody kind of all in. And if you have a talent, a skill, it can be put to work and to good use. So there's so many nonprofit organizations that people can partner with in their personal lives on all kinds of levels. And we need you. So we want you to do that.
I love that. And obviously, you know, as an educator, I'm not going to let this go by saying, find a kid who can't read. You know the statistics. If a child is not reading by 4th grade, they'll more likely end up in a prison than
That's
college.
right.
And so if you find a child whose school can't pivot to on-site instruction, offer to help a parent support distance learning. It's a really,
and there are millions of children who don't have access to technology. There, you know, almost 70% of low-income children don't have books at home because families are trying to figure out, do I have money for food or rent, or can I keep the lights on? So books are a luxury. So you can build a home library. You can do a virtual read aloud, you know, with kids. That's a big part of what we're trying to do, because, I mean, Columbia is an amazing educational experience. And just imagine if your entire educational opportunity is completely, you're cut off from it. What are your prospects right now? And what's happening right now in communities around the country, and certainly in New York City, it's just crushing. But there's something that each of us can do about it.
I love it. I love it. Well, we are coming to the end of our time, and because I said we're going to be authentically ourselves. I use music and poetry as a part of my leadership. It's a part of changing, I call it the air particles in a room, so that we convene or we close. And I'm going to thank the 3 panelists by reading a poem to them that I can't reach you with a hug. And even if we were in the same room, I'd have to kind of 6 feet, you know, hug you. So I want to leave you with a few of the words from one of my favorite spoken word poets who's from New York City. Her name is Denise Froman. And then I'll say goodnight to everyone else. But first I want to create an intimate space for us, because I just love what we've created in this moment, and the energy, the expertise, the passion, all of it has been so inspiring. So this is for the 3 of you. I heard a woman becomes herself the first time she speaks without permission. Then every word out her mouth a riot. Say beautiful and point to the map of your body. Say brave and wear your skin like a gown or a suit. Say hero and cast yourself in the lead role. When a girl pronounces her own name, there is glory. When a woman tells her own story, she lives forever. If this poem is the only thing that survives me, tell them this is how I happened. Tell them I built me a throne. Tell them when we discovered life on another planet, it was a woman, and she built a bridge, not a border. I heard this is how you make history. This is how you create a world. So thank you, Alex. And thank you, Aletha. And thank you, Sheena, for the worlds you create, for the spheres that you influence. We are just so proud to claim you as Columbia alumni. And I ask everyone who is convened under the sound of our voices tonight, if you're interested in volunteering, you can even volunteer for Columbia. You know, go to alumni.columbia.edu, get involved with your regional club, find an interest group. Columbia can also be your home for doing meaningful work in the world. You know, there are lots of Columbia alumni associations all over the world. So please, if you find yourself with time on your hands, we are also a place where you can put your hands to good work. Please also make sure that you stay in touch with Columbia at Home. Jody Cantor, whom we all, I think we know, class of '96 from the college. Jody is going to be looking at journalism and the public trust in the next Columbia at Home series. There's so much going on, so much that we need to be thinking about. That will be October 21st, 7 to 8 p.m. Eastern Standard Time. Again, if you are interested in that, go to alumni.columbia.edu. But we are at 5:02, so this preacher's daughter didn't go over time very much. But I love this space that we can create as fellow Columbia alumni. Thank you for the privilege of being in your company, Alex, Aletha, and Sheena. I love you. I wish I could be with you, but I actually am with you. I'm with you in the work.
Thank you.
We're in the work together. So
thank you.
Thank you.
Thank you. Wow. Thank you, everybody. Thank you, Columbia family. Thank you for joining us tonight.
All right. Bye-bye.